During the lab activity, we use electromyography or EMG to capture muscle activity during various tasks. In this lecture, we will talk about application of electromyography in the field of kinesiology, procedures for EMG data collection, and how the data are analyzed. The electromyography is a study of the voluntary neuromuscular activation of muscles. Analysis of muscle activation patterns can be used to evaluate postural tasks, functional movements, work conditions, and treatment or training regimens. The main areas in which the electromyography is used in the kinesiology field are medical research, rehabilitation, ergonomics, and sports science. In medical research, EMG is used to aid in performing a surgery, evaluate patients' nerve function, and in analysis of gait and posture. In rehabilitation, EMG can be used as an evaluation tool or a means to provide real-time feedback to the patient. In ergonomics, the EMG is used to evaluate workplace design or to design a workplace that minimizes the demand on the body. In sports science, EMG is commonly used to study muscle activity during sports skills to identify ways to improve performance or prevent injuries. When we use EMG, two electrodes are placed along the same muscle. The data that we get reflects the difference in electrical potential detected by the two electrodes. When the action potential propagates through the muscle membrane, the membrane potential changes from its resting level of negative 70 millivolts to about 40 millivolts, and then back to the resting level. This results in difference in membrane potential underneath the two electrodes. The EMG is recording the difference in the electrical potential detected by these two electrodes. To be more specific, the EMG is recording the difference in this electrical potential from multiple motor units detected by the two electrodes. Since the muscle beneath the electrodes consists of multiple motor units, we are unable to distinguish the signal from individual motor units using the standard electromyography technique. The raw EMG data we get from the EMG analysis reflects muscle activity of all the motor units from which the signal was captured by the electrodes and all muscle fibers that make up the motor unit. As shown in the picture on the right, different motor units are fired at a different frequency. The signal from all motor units are superimposed or summed up to create the EMG data that we capture. The EMG signals from the muscles can be affected by several factors before even reaching the electrodes. One of the factors is the characteristic of the tissue between the muscle and the electrodes. Having a thicker layer of subcutaneous tissue or fat in or skin can attenuate the EMG signal before reaching the electrode. Your hydration status can also affect how much water you are holding in your body and affect the EMG signal. Physiological crosstalk is what happens when the electrodes mistakenly picks up the signal from the neighboring muscles that you are not studying. The signals from these muscles can interfere with the EMG signal from the muscle that you are trying to study. When you move the joints or contract the muscle, movement occurs between the skin and muscle. The skin to which the electrodes are attached to will glide over the muscle. This relative movement between the muscle and skin can affect the EMG signal in that part of the muscle that you are getting data from may be changing if you are collecting data during a large joint movement. At last, external noise from slight movement of the EMG sensors or 60 Hz noise from the ground electricity can contaminate the raw EMG signal. Now, let's talk about the data collection process involved in collecting EMG data. For For our lab, we used the free EMG system with 2 silver-silver chloride electrodes. The electrodes were pre-gelled to maximize signal conduction. The data were collected at 1000 Hz, which is a common sampling frequency used to capture surface electromyography. The advantage of surface EMG is that it is relatively easy to use. However, it is not suited to study deeper muscles that are not located near the skin. Alternatively, some systems allow you to insert a wire into the muscle using a fine needle. Inserting the wire directly into the muscle allows the investigators to study deeper muscles. The first thing to do for the EMG setup is to prepare the skin for electrode attachment. This is an important step in reducing the electrical impedance at the skin. It is important that we shave the area to remove hair, since hair can affect the adhesion of the electrodes to the skin and may lead to electrodes coming off during the testing. After shaving, the skin is cleaned and abraded with alcohol prep pads to remove dead skin cells. Once the skin is clean, the electrodes will be placed on the skin. In order to allow comparison of EMG data between studies or between sessions, the electrodes are placed on the standardized location, usually based on prominent anatomical landmarks. The electrodes are placed next to each other and in a direction parallel to the muscle fibers. Typically, the 2 electrodes are placed so that the distance between the center of the 2 electrodes are 2 centimeters. This distance is called the inter-electrode distance. Once the electrodes are placed on the skin, it is recommended to wait 3 minutes for the gel to warm up to the body temperature and the signal stabilize. At this point, we secure the electrodes to minimize excess movements and check to see if the system is actually capturing a good signal from the muscle. Typically, the next step in the EMG data collection is the maximum voluntary muscle contraction. This is a step in which we ask the participants to contract their muscles as hard as they can and hold it for 3 to 5 seconds so that we can capture the EMG signal when the muscle is working as hard as it can. The data collected during the maximum voluntary contraction will be later used as a reference when we calculate the activation level of a muscle. Once the maximum voluntary muscle contraction is performed, the subject can proceed to performing the task that you are interested in.